Welcome to the channel. Urinary tract infection is one of the most common infection affecting millions worldwide. Whether you are a male or female, young or old, UTI can strike anybody. With the proper knowledge, you will come to know that urinary tract infections are usually preventable and usually treatable. So let's dive into the topic of urinary tract infection, UTI. Chapter 2. What is urinary tract infection? Urinary tract infection is an infection of the urinary tract right from the kidneys down to the ureters to the urinary bladder and the urethra. Usually, urinary tract infections are most commonest in the urethra and the urinary bladder. It is very common for a female to have urine infection in her lifetime, but men are having lesser incidence of urinary tract infection. But as the age advances, even men can have urinary tract infections, UTI. Chapter 3. Types of urinary tract infections, UTI. Urinary tract infections can be broadly classified according to the anatomical place of the urinary tract where they are infected. The most common one is urethritis, that is infection of the local urethra. The next one is cystitis, that is infection of the urinary bladder. Then we have ureteritis, that is infection of the ureters. And finally, we have the most problematic one, that is the pyelonephritis, that is infection of the kidney itself, the parenchyma of the kidney, what we say as the muscle of the kidney. That can worsen into renal abscesses, kidney abscesses, and also there is a variety called as pyonephrosis, where there is a pus collection in the entire kidney. The higher up infections, especially the kidney infections, are the ones which are the worser ones, and they can lead to complications if not treated properly. Chapter 4. Microbiology of urinary tract infection. The most commonest organism causing urinary tract infection is Escherichia coli or E. coli, which is a bacterium living in the intestines. The other bacteria which are commonly seen are Klebsiella, Proteus, Enterococcus, etc. And in few cases, it can be because of fungi and viruses, especially in patients who are hospitalized and or immunosuppressed, immunocompromised. The bacteria have cilia and flagella which help them stick to the urothelium, and then they can proliferate and ascend upstairs. While they are stuck to the urothelium, they are covered with proteins and debris, and this forms a biofilm. This then leads to recurrent and resistant infections. Chapter 5. Causes of urinary tract infection. The risk factors and common causes of urinary tract infection include diabetes mellitus, especially if it is uncontrolled, use of immunosuppressive medicines. The other common factors include poor local genital hygiene practices, sexual exposure, holding of urine for too long, use of urinary catheters, menopause in females, and enlarged prostate in men. Chapter 6. Symptoms of urinary tract infection. Urinary tract infection can have various symptoms depending on the anatomical site of the urinary tract which is involved. But then there can be common symptoms also. The most commonest symptoms would be burning while passing urine during micturition. The second would be frequency of passing urine, especially even when the bladder is empty. You will feel that you want to pass urine. That will be the lower urinary tract symptoms. There can be pelvic pain, discomfort. There can be backache or lower abdominal pain. There can be fever with chills, especially when the kidneys are involved. And there can be foul smelling urine or cloudy urine or blood in the urine, hematuria. In the elderly people with urinary tract infection, there can be a confusion state of the mind or changes in behavior. Chapter 7. Diagnosis of urinary tract infection. Clinical diagnosis of urinary tract infection is usually straightforward and starts with the basic test of urine routine microscopy, which is a clean catch midstream sample. That helps us to find out under the microscope about white blood cells, red blood cells, and bacteria presence in the urine sample. The next test would be urine culture sensitivity, which also is a clean catch midstream sample that helps us to find out the specific organism and also the most effective antibiotic for that bacteria. Then, if any structural factor is suspected or if there is a urinary tract infection which is recurrent or resistant to antibiotics, then we require imaging services which include sonography and or CT scan of the KUB, that is the kidney ureter bladder system. Chapter 8. Treatment of urinary tract infections. The common uncomplicated urinary tract infections can be treated with oral antibiotics. The choice of oral antibiotics depends on the local resistance patterns and the report of the urine culture report, which comes later on. The commonly used antibiotics include cephalosporins, trimethoprim sulfamethoxazole, ciprofloxacin, nitrofurantoin, and sometimes fosfomycin. For pain relief, dicyclomine can be used. The patients with having severe urinary tract infection or kidney related infections may require intravenous antibiotics and hospitalization. Chapter 9, Recurrent Urinary Tract Infections. Some patients, especially women, will have recurrent urinary tract infections, which is defined as more than 2 episodes in 6 months or more than 3 episodes in a year. In such cases, more detailed investigations are required to rule out anatomical abnormalities, kidney stones, hormonal imbalances, or chronic illnesses like diabetes mellitus. Chapter 10, Prevention of Urinary Tract Infection. Prevention of urinary tract infection includes few lifestyle changes. Keep yourself well hydrated, drink plenty of fluids including water. Do not hold back your urine. Urinate before and after sexual intercourse. Maintain proper genital hygiene. If you are having recurrent urinary tract infection, few measures may be advised to you. The cranberry extract may be given to you. Long-term antibiotic low-dose prophylaxis may be given to you. Post-exposure prophylaxis may be given to you. And if you are postmenopausal, local vaginal estrogen ointments may be given to you. Chapter 11, Special Considerations, UTI in Children and Men. UTI in children requires special care. There may be non-specific symptoms like fever, irritability, vomiting, and failure to thrive. In recurrent infections in children, we may have to consider vesicoureteral reflux as one of the causes. Men, especially older men, get urinary tract infection due to prostate. In men, if there is a urinary tract infection, it is considered to be a complicated urinary tract infection and requires thorough investigations. Chapter 12, When to see a doctor for urinary tract infection. Consult a doctor if you are having symptoms lasting for more than 2 days, if you are having fever with chills or backache, if there is blood in the urine, hematuria, if you are having repeated urinary tract infections, if you are having urinary tract infections during pregnancy or in a child, if you are having urinary tract infection with vaginal discharge or sores. Prompt medical attention is essential to prevent further kidney damage, sepsis, or chronic infections. Chapter 13, Conclusion. Urinary tract infections are common but usually treatable. Prompt diagnosis, early treatment, and some few simple preventive measures can help you stay healthy and prevent discomfort. If you suspect a urinary tract infection, don't ignore it. Get it checked. If you find this video useful, kindly do share, like, and subscribe. Also, inform all your friends and family regarding the medical knowledge. If you have any questions, do write in the comments box and we will be happy to answer you. And also, we will make more videos on those questions. Thank you.